Can everybody hear me? Yeah. Okay, good. All right, I'm Julie O'Connor, and I'm an aquatic specialist at Sun City, Texas, and an aquatic personal trainer. I've been doing water since before I could walk. I've been swimming for my whole life, and I got into this career because I wanted to be a physical therapist. However, that was a very hard program to get in at the time in the early 90s. So I just started with working people in the water, teaching exercise, and to make extra money at the time. And then it just turned into a career. My first client, I worked for the Lions Foundation in Phoenix, Arizona, which everybody I think has heard of Lions International. And we had a pool there, and so our primary clientele was people with spinal cord injuries and neurological disorders. And so I have had a lot of experience with people just like you, and I also have post-surgical condition, had a bone tumor removed that affects my right foot in neuropathy. But and also, I am a fish out of water. I haven't done public speaking in many years, so bear with me. And I learned PowerPoint. I'm so excited. I've learned so much in the last 3 weeks. And that's what I was feeling like for the last week. So I couldn't pass on that one. I just loved it. I mean, it's really amazing what you can do with these things. Well, so neuropathy and exercise. Now, in general, I was asked to come, it was just put out there on our Sun City for our employees that they needed a speaker. Beth White she's our director, I think she's called, at Sun City Fitness Center, and she usually does the speaking, but she put the note out, so I thought I'll take it. And I'm going to be speaking specifically about aquatics, but exercise in any form. I mean, aquatics may not be for some people. That's okay. But that's what I'd like to focus on. And so safety first. Bob mentioned the shoes. We need to have shoes in the pool. The safety on the deck of the pool is primary because those tiles are very slippery. And if you have a sport that you enjoy, do what's good for you. Keep moving. I think that's the one takeaway on all of this, is that when you stop moving, your body starts rebelling, and you keep yourself moving, you get oxygen to the tissues, you stave off that progression of your neuropathy. I always tell people to listen to your body, and if it hurts, don't do it. You got kind of a fine line with the condition that you're dealing with, but that's why I love water, because generally it doesn't hurt in the water. So, Bob, what do you say about that? When you're in the water, does your neuropathy lighten?
With arthritis primarily, it doesn't bother me, and of course we do wear shoes.
Yeah.
And I'd recommend people that travel with neuropathy, they need to wear their water shoes to keep from slipping in the bathtub. When they.
Yeah, that's a great idea. You can use them at home. They're great, and it's season right now.
If it's not handicapped, equipped, then you've got a problem.
Right, and you can get those at any Walgreens, CVS. It's season now. How many swimmers are here, or water exercisers? Oh, that's pretty good. So hopefully I'll make some more converts. I love what I do. I'm very passionate about it. And then the 2-hour rule is just a general rule, because for any exercise that you're doing, if you're sore in your joints or you're feeling a worsening or fatigue in your nerves, then you've done too much. And water is kind of tricky that way. Sometimes we feel like we can move and maybe work a little too hard and then get frustrated and don't go back. So that's why I teach, my class is called Aqua for Balance. And, it's a level 1 class that everybody can do. And, that I teach, I watch what people are doing, I correct, not targeting anybody specifically, but I correct the movements because my primary concern is to make sure you're doing the exercises properly. Sometimes we get in the water and it's just like you bow to the water instead of strengthening core and moving against the water and letting the force get you stronger. And again, as I'll say it 1,000 times, move it or lose it, you're going to gain more problems. And this is my little balance slide. All right, so why choose aquatic exercise? You're going to improve your muscle strength and increasing your circulation. You're oxygenating your blood. When your blood's oxygenated, then you're going to have better circulation to the nerves. And as Karen said, is that right? I'm sorry, Nancy, apologize. As Nancy said, that the nerves do regenerate. And that's just come about in the last 10 years. Doctors, I would say that in front of a doctor when I was working with my spinal cord injuries, and I watched 2 people learn how to walk again with complete spinal cord injuries. And they used to say, never say that, Julie. Nerves don't regenerate. So I'm glad that the world knows now that they do, and there is hope for that. Your coordination, by doing various exercises. When you walk in the water, you're coordinating your arms and your legs. It's a great way to decrease pain. That's one. I work a lot with pain management and on my one-on-one trainings. And I will explain to you the equipment here in just a little bit. And of course, decreasing your weight bearing on your joints, because many of us do have arthritis or spinal issues. I also had a diving accident when I was 16, so I understand, the pain of a collapsing spine. I used to be 5'10", I'm only 5'8" now. And my doctor, I went to get evaluated, and he said, do exactly what you're doing because it's fusing. My back is actually fusing now without impinging the nerves in the spinal cord. So he's just like, stay in that water, keep teaching. It's wonderful to get paid for what you love to do, All right. And as Bob said, too, improve your balance. When you're in the water, you have the water holding you up. And there's so many things that we can do in so many different positions that we can put our body in that we would never be able to do on land. And when you strengthen your muscles overall, you're going to have, if your muscles are stronger than your bones, you're going to decrease your pain, and you're also going to have more mobility. Okay, so what do you think of when you think of, if somebody says, I'm going to water exercise today? How do some of you picture that?
Walking in the water.
Mm-hmm. Yes, that's a good one. And they have various classes. They have, the deep water classes and shallow, which is where I work in. I do use some of the 5-foot part of the pool when I'm doing noodle work with people. And of course, that non-weight bearing. Some people need to get off their feet, but you can still exercise and strengthen, so that's important. And for training, one-on-one training, what I do at Sun City is, first of all, I meet with you on land. That's a free assessment. I get to know you, your specifics, a little medical history, your hobbies, your interests. And that way you can get to know me, I can get to know you, and then we can formulate a plan. When I first get a person in the water, my whole goal is to see how are they moving. I have you walk forward, backwards, side, and I can see variations and deviations in movement very well. because the water acts as like a slow motion machine. You know, it's like a kinesiology, a biomechanics person would see on their computer screen. So it slows it down, and I can correct those things that need to be corrected. The other thing, let's see. Well, and of course, with OneonOne, we focus more on specifics. I get a lot of post-rehab replacements and that kind of thing. For neuropathy, some people aren't ready to go to a group class. They're not safe enough to be in the group class just yet. So they come to me for a couple of visits to get their confidence. And excuse me, I need water. Water. My lifeline. So yeah, and then you can address your cardiovascular. We increase the speed of movement. Then you can increase the intensity of the exercise. So it's really the water, you can control your intensity for pain relief and range of motion, or from cardiovascular and endurance. Swimming is also, did I ask how many swimmers do we have? Actual swimmers.
I used to be, and I can't anymore, but I'm in the water.
I know you from class. Yes.
Well, I don't do classes anymore either.
Oh.
I used to.
Okay.
I'm in there on my own about every other day.
Yes. I know the face.
Lots of, tricks that work.
Mm-hmm. Yeah, so, and you don't have to be a swimmer. That's the wonderful thing. We work vertically in the water. You can stay at a depth of water that's comfortable for you. The methods that I use in OneonOne training are all based on hydrodynamic principles of drag, resistance, buoyancy. That's how I choose my equipment and how it's best going to serve the people that I'm working with. And let's see, we also have a lot of fun. Yeah, so that's one of my, I should probably had a photo release in there, so if you recognize anybody, don't tell them. All right, so that's the class. I teach Aqua for Balance 5 days a week, and you can always look that up. If you're in Sun City, you can look that up at their fitness center. They have, or your sun rays, or your computer. Okay, so the buoyancy. Since you have that, I mean, it's just simply, it's buoyant. This astronaut that just came back. Can you imagine? And exercising in that completely 100% buoyant. Zero gravity. Yeah, he grew. Yeah, and he'll come back down to earth too. That great. But first thing he wanted to do was get into his backyard pool. That's what he said, because it's such a comfortable place. Water temperature. Some people struggle with that, but at Sun City, where they maintain the pool temperatures very well. If you're not from Sun City, there are programs. I mean, we have our community center here in Georgetown, but the water temperature is more geared towards swimmers. So 78 degrees is bone-chilling cold for those of us who aren't moving real fast. But we keep ours at 85 at Sun City. There is pools. There's a pool in Round Rock that has 92 degree. It's therapeutic temperature. And they also have the YMCA. They have the YMCA in another place in Round Rock that have warm pools. So if you're not a Sun City resident, there's options there, and you can pick my brain on that if you'd like. All right, so we've gone over the balance. The buoyancy lifts us up and supports us, whereas like we're doing an exercise. I have them stand on one leg. Okay? How many of you could do that if you were going to stand up here and do that right now? It'd be hard, yeah, it'd be hard. But yeah, I have a whole set of balance-specific exercises. The water helps you up. I see so much improvement with people. I mean, Bob's a living testimony, and I just see lots of improvement and positive gain for everybody. Resistance, of course. I have Muhammad Ali. He had Parkinson's. And, but, he trained in water too. But that resistance is when you go from air to water, you're actually getting 17 times the resistance as standing on land. So just that, and then you start moving and you're adding speed and everything. That's a lot of resistance. Okay, and I like that you talked about the Tai Chi because I also teach I Chi. It's a method in the water. And it's based on Tai Chi, but made specifically for water. And it's great. It focuses your breathing, your balance, and, just relaxing is good for you. I've noticed lots of people with their mobility has improved. They've gotten rid of their walkers or their canes. And, but if you need them, I always recommend them for the deck because we don't want to have accidents on the deck at the pool. And of course, the strength is kind of going in with the resistance. They're tying together and improving your quality of life. If you're moving every day, which you should, a little bit every day, if you're moving, you're going to keep, disease at bay. It's like with Parkinson's, they always say, for everybody, as you grow older, keep moving. Because otherwise, we go back to our fetal position, and, we lose mobility in our legs, and then we're drowned down by our shoulders, so you want to fight that gravity from pulling you down and making you fall down. And also people, it's important. Our eyes are very important when we're exercising in the water. Keeping a focal point. Most people that fall, they're looking down right where they're falling. Or those walkers, it's this. So you've got to just be really cognizant of your visual field. And that's why I will have people open their eyes, close their eyes, and try it. Closing your eyes gives you kinesthetic awareness where your body is in space. And it also makes your brain work a little bit harder for your body. Excuse me. I kind of wish it was. When I get to I'm leaving, I'm going straight to vacation after this, and I'm going to go right to the pool. Okay, and of course, exercise is fun. I always tell I have 2 rules in my classes. If it hurts, don't do it, and have fun. Okay, and social interactions, of course, are very important. I also you'll see it's kind of, each person has a noodle, so they're working in teamwork. So I have teamwork exercises, and our group is just a really wonderful group of people. They're friends in the pool and out of the pool. We care for each other. If I haven't seen somebody for a long time, I'm going to call and see or somebody from the class will generally call and see how they're doing because, just need, sometimes people need a prodding too. Once you stop exercising, it's easy to not go. Okay, so here we go to, let's see. These are aqua barbells. They come in many different sizes. These are the minimum. So you're doing buoyancy, resistance. With these, great for strengthening, range of motion, and just when I'm walking with them like this, sometimes I'll have people push down and then just keep them under the water and walk and see how much that changes your posture.
Julie, how high would the water be under your knees?
Generally, below the breast, at waist, or if you're doing it in deeper water where it's closer, if people have shoulder issues or something, then I encourage them to be deeper. But this becomes harder because they have a longer way to go. But what I always tell them, press till you feel a contraction. And where you're going to feel that contraction is in your core. So somebody had mentioned, some doctor said, there's no way you can gain core strength in the water. And I'm like, oh, I need to get him in my class because there is so much to be gained. And also, these are available at most pools, the different sizes. I didn't bring all of them because I couldn't fit it all. These I put on around a railing at our pool at Sun City. And then we used that for upper body strength. So if you've seen your sun rays last month, February, yes, there was a lady that I worked with. They show her using these. And we just put them on one of the ramp poles, and you can work your upper body and then range. And this is something, this is a piece of gym equipment, but it was made for the pool. And I have some people who have arthritic hands. They can't grasp things. So this is a nice little, so grabbing this, very narrow, causes them more pain sometimes. Or if you've got neuropathy and, that feeling is the tingling and stuff, if you're squeezing too hard, could aggravate it. So right here, you just slip your hand in here and you can still have the same benefit. This is my personal training equipment. So I'll put these over here. These are what I use. This is what they have at the fitness center. Sometimes people want to learn adapted swimming, and that's what I do. They've been swimmers in their lifetime and decide they want to do it again, learn. And so we adapt the stroke, because as we age too, our flexibility in our neck and extension of our arms, it takes work to get back to doing that again. But these add resistance too. Just another option for strengthening arms. If I lift up, I'm strengthening the upper back. And then some of you who may have been to physical therapy. How many of you have been to physical therapy? Yeah. Well, the band, sometimes I'll do that if I've got somebody who's weak through here, and we'll have them walk in the water with the band, and you can do it. And regardless of your sport, I take golf clubs in the pool, tennis rackets in the pool. So I'll use, just about anything you can do on land, I can show you to do in water and strengthen that. Some people want to just I want my golf swings not looking, feeling right. Well, I can see how you're doing it. And then, if you're following through and leading with your hips and doing all that stuff. I also have, now these are real weights. So if you're in the gym, let's see, I got one more. I guess I only brought one. I'll put these on people's ankles because they promote sensory perception or sensory input. And when I put them on, we'll have them walk across the pool a few times. Then we take them off. And then they have a better stride and better positioning because you've already loaded the muscles and given that sensory input. So when you take them off, your brain still remembers that. And so it helps you to move better afterward. And so this is 2. Sometimes I'll use wrist weights. They're 1 pound. And just various things. And then this is your 5-pound weight that you might find in a gym. You can do weights in water, find the right material. And because land, you may not be able to do that. So there's,
How do you compare Julie to the bell,
Aqua Bell. Oh, this is buoyancy resisted. So you're pushing against the water. This is buoyancy assisted. So you're working something with gravitational potential.
Is there greater weight in that one?
Oh, yes. Yeah, this one's 5. So I would say if I were in the pool, because we have so many different kinds with different surface areas, this is probably about 1 pound. If you get to the bigger ones, you can get up to about 3 or 4 pounds comparatively if it's a weight. I get that question a lot. And so those are a few examples. I also have a Speedo. One thing nice that Sun City has is a Speedo step. So people who have difficulty with their balance and ascending or descending stairs, we can practice using that in-water step. And it really helps people improve their balance. And this right here, I think I kind of skipped on. Let me see here. Oops, back. All right, the methods, again, I said we're based on hydrodynamic principles. Badragas, we have a whole language for aquatics. Haloic, it's a way they teach swimming in Europe. It's a specific method. Aqua stretch is for pain management and mobility, and it's hands-on. And I also do massage in the water, this goes around your head. Got this on camera. This is going to be the best looking me yet. Very fashionable horse collar. And what that does is allows me, you keep your head out of the water, and then we put these on the ankles. So you're completely floating. You're no stress whatsoever on the body. But when I put you to work, some people are, like I said, I get a lot of post-surgical, or the neuropathy is so severe, they can't even walk in, they have trouble with the walking in the water. And we put those on the ankles, then you're having resistance. This acts just like these do. And I'll have them flutter kick on their back, range of motion in the hips, opening and closing the hips, and leg presses. We can push them again. I can hold them with their feet to the wall, push them in towards the wall. They can push out. And there's your leg press. You can bicycle. And same with, with the noodle, you don't need assistance with the noodle. That's one that most people can use. This is where I find that people that sometimes will come to class, and my other rule is no drowning in my class. And so, this is awkward if you're not used to using this and you're not a swimmer. So then again, people come to me for a 1 or 2 visit to give them the confidence to progress to the group, because it's always about safety too. We want you to be safe and all the other people. These, I also do, when I have the collar on, I can do massaging in the back, light traction for the back, because I'm holding the back here. Person's floating. I can put my foot in the small of the back and gently stretch those back muscles, hips that are so tight from being guarded and walking. We can stretch the extensor muscles, and there's just so many things that we can do with the equipment. Do you have any questions?
I just mentioned that with that noodle, you can really do some cardiovascular by bicycling and jogging in the water without even hitting the bottom of the pool. You can do as much as the water takes.
Yeah, that's why the deep water is, having the noodles. And sometimes I'll have people who are not real comfortable with the water. They'll use 2. This is a big one. This is from my house. We have smaller ones at Sun City. And put one under each arm. You look like a boat. But it works very well to help people who are not real comfortable using them. They get that extra support. Okay.
How many people are generally in a class?
I limit my classes to 17 because I work with high-risk population, people who may fall, and if I have to be able to get to them very quickly in the pool if they fall off their noodle. So but generally we were sold out every month for 3 years, and then they changed it, which this is kind of a nice change for people at Sun City. Now my class is a ticket class, and you just go in, buy one ticket, and just sign in for that time of the class that I have. Aqua for Balance is registered as that. And but we're getting it, now that it's warming up a little bit, it's getting busier. Pardon?
There are lots of different.
Oh, yes, they have lots of different classes. You know, mine, like I said, I stay in the beginner range. I'm in the pool about 5 hours a day, so I need to conserve my energy. I don't do a lot of aerobic training unless I'm doing that specifically with somebody one-on-one.
Are all of your classes inside?
Yes. My one-on-one is in the total covered pool. Then they have the retractable ceiling, the aerobic pool where all the classes meet. Okay. So went through equipment, okay. So basically, you know, the goals of exercise in general are to improve your activities of daily living. You know, just sitting and standing is an important skill. You know, we cross over our body, brushing our hair, brushing our teeth. There's a whole set of exercises. I'll throw out a big old word for you. How about this one? Proprioceptive neuromuscular facilitation. It's a series of exercises that we use in cross motion that helps to activate the nerves in the spine and stretch. All right. Pain management, because with neuropathy, pain and even, you know, you may have numbness, you may have pain, you know, I think they go hand in hand. Depression is a huge issue for people with any kind of medical condition. And moving, of course, you know, activates your brain chemicals, your positive brain chemicals, your endorphins. That improves your mood. And just being around people, like-minded people, and I mean, our group is just such a wonderful group of people. All of them are at Sun City. They're just wonderful people that want to exercise and keep moving and stay involved in life, and that's important. All right, and is that just overall quality of life and well-being, and the social. And for me, especially in one-on-ones, I want to see, and in group, I want to see people succeed. I love to hear people say, I tied my shoe today for the first time in 6 months, you know. I put my sock on, or I was able to sit to stand, or I was able to reach for something. That's what I want to see. I want to see people, you know, having successes in their movement every day.
Do you recommend a one-on-one session before?
Yeah, I do, only if you're not familiar with the noodle and some of the other exercises. But if you are comfortable in the water, just come try the class, you know. And I'll teach. Like I said, it's a level 1. My only concern is when people are very unbalanced and they're not familiar with the equipment, that we teach them safely.
How are you on husbands who have to be dragged? How are you?
So, do you get in the water?
No.
Oh.
He's the one who wanted to be doing this.
Yeah, there you go. Well, and we have lots of guys in my class. I have probably, you know, on and off 3 or 4 guys in the class. Sometimes we'll have more men in the class than we have women. So it's just all gender, and so just try it out.
Don't worry about what you look like in a bathing suit, because none of us are going to win.
That's right. I'm giving a Speedo away today. No, I'm kidding. All right, and so it brings us to what you're going to need for the water. Did you have a question?
You said you use tickets. My wife has tickets. Can I use those tickets?
Yes. Yeah, for any of the classes. Any class. It's 1 ticket, except for the ones that say that they're a series. I previously was a series class, but they changed
Is
them.
it a family group for the ticket?
Yeah, the ticket should be on yours. Yeah, that's the way I understand it. Your household. All right, and number 1 item you need to do is get aqua pool shoes. Neuropathy, you know, diabetic neuropathy put you in huge risk if you don't have coverage over your feet. I learned this the hard way. You can see I'm not so red anymore. I just was treated for skin cancer from top to middle here, and so now I am going to wear sunscreen, so I'm going to actually practice what I preach. And I also sometimes will wear the SPF clothing is recommended. You know, your bathing suits, There's lots of options for bathing suits. You know, a lot of women wear running shorts, you know, and a lycra top. You know, it's just, as long as they're not cutoffs, and I don't think anybody's going to wear cutoffs, so, then you're doing good. And I always recommend the walkers or canes in the pool area because it's just a good plan to have. And then if you want to dump it once you get to your car, but I just want you to be safe in the fitness area. And bottled water. We don't realize how much the chlorine water leaches our system. You feel like you're not sweating. You are sweating, and you know, especially in the summertime. So having water at the poolside, I always recommend it. And if you find you're fatigued or those nerves are acting up a little bit more, a lot of times it's water that you're missing. You know, people get into exercise and they just forget. So highly recommend that. And let's see here. I'll put him up. He's my guy. I have a dog just like that. I had to take him to the doggy jail today, and I'm so sad. So I'm going traveling. All right. Thank you so much.